Hi everyone, welcome back to Chapter 5, the chapter on consciousness and sleep. In the last video, we talked about the different stages of sleep and why we sleep. And in this video, we're going to talk about dreaming. So, what are dreams? Why do we dream? That's the big question. So, dreaming, as we talked about in the previous lecture, can happen at any stage of sleep. However, the most realistic dreams, the most story-like dreams, will occur during stage 5, REM sleep. Now, when we're talking about dreaming, we like to define it as something that's a universal experience. In other words, everyone dreams. So even though everyone's been brought up in different cultures, we still dream, and there are some consistencies across cultures as to what we dream about. And usually it's about things we experience during the day, or something that's happened to us previously. And what's really cool is that even people that were born blind will still experience dreams. Now, they may be slightly different than the typical dream that seeing people have, but they do still experience dreams. So that's pretty cool. So because they're all universal experiences and everyone will experience dreams, then the real question is, why do we dream? So some people suggest that dreams help us process emotional memories, that they're a good way to kind of process things that maybe we didn't fully understand before, for some bad memories, or to re-experience good memories. Also, dreams may help us learn new strategies or ways of doing things. Some people say that they're a way for us to kind of compartmentalize what we learned throughout the day. They may help us experience that kind of what if of you had two choices and in real life you did choice A, but in your dream then you can experience what would have happened if you picked choice B. So again, it's kind of a way of kind of settling the mind so you don't constantly think of the what if. Now, we have a couple of theories about why we dream, and the first one is from our best friend Freud, who we talked about before. He had a theory of consciousness, remember? But here we're talking about Freud's dream protection theory. And in this theory, then it describes dreams as the guardians of sleep. So pretty much that during sleep, the ego, which is like a mental censor, is less able to keep sexual and aggressive instincts at bay by repressing them. In other words, your dreams are made up of these repressed sexual and aggressive instincts that during the day your body represses, but during dreams can be set free. So, again, then Freud's dream protection theory says that the dream work disguises and contains the pesky sexual and aggressive impulses by transforming them into symbols that represent wish fulfillment, or how we wish things could be. So in other words, what he's saying is that the main purpose of our dreams is wish fulfillment, the gratification of our unconscious desires and needs. And for this, then sexual and aggressive urges that are too unacceptable to be consciously acknowledged and fulfilled in real life will be altered in a way that they can be fulfilled in the dream. So this is where we've got surface story versus latent content, which is its distinguished psychological meaning. Now, the second theory of dreaming that we're going to talk about is activation synthesis theory. And so this theory proposes that dreams reflect brain activation in sleep rather than an unprocessed unconscious wish. In other words, there's nothing really to do with the unconscious, like Freud's, but rather it's just random brain activity that leads to dreams. And this is due to a balance of neurotransmitters, primarily acetylcholine, serotonin, and norepinephrine, in the brain that shifts continually while we sleep. So what we'll actually see if we do like an EEG or an fMRI on sleeping patients, then we'll actually see different brain areas such as the somatosensory area, the visual area, the motor cortex. They'll all actually continue to fire during dreams, similar to if they were firing when being active in an awake person. However, this is due to kind of a random brain activation due to this continuously shifting balance of neurotransmitters. So the shifts in the neurotransmitters concentrations during the night will activate or depress different brain areas, such as I was talking about with the visual cortex, so that may be why some people's dreams you see things, or the auditory areas where you can then hear things. And so this causes a chaotic pattern of neural firing. And this is translated by the forebrain as effectively as possible. In other words, the forebrain takes all of this random firing and tries to create an explanation for why all of this is firing, and that's what kind of creates the storyline in the dream. So when we're awake, the neural circuits in our brain are activated by sensory inputs like sight, sounds, taste, etc. But during REM sleep or other dream stages of sleep, then the brainstem bombards our higher brain centers with random neural activities. And the cerebral cortex will interpret these patterns of neural activity to then produce a meaningful perception. So it's really trying to make sense out of the random neural activity. So we're creating a dream that best fits the particular pattern of activation that exists at any particular moment. So that's really it for dreams. Now we're going to talk about a couple sleep disorders that can occur during different stages of sleep, as well as kind of connected to dreaming as well. So the first one we're going to talk about is insomnia. This one's very common. In fact, it's the most common sleep disorder, where 10 to 40% of the population experiences insomnia. And insomnia is defined as chronic difficulty in falling asleep, staying asleep, or experiencing restful sleep. So in other words, it's not just a one-night difficulty of falling asleep. It's a chronic, multi-night, kind of building on itself difficulty of falling asleep or staying asleep. And also, people with insomnia don't experience restful sleep, which means they aren't able to get down to sleep stages 3 and 4. The next one we're going to talk about is narcolepsy. So narcolepsy is where people will experience sudden episodes of sleep. They'll actually go straight from full awakeness straight into REM sleep. with really no warning signs, so people will just fall asleep. And this can be dangerous for people because they can, fall asleep while driving, just while walking, they just collapse. So it can be dangerous. And sometimes narcolepsy has been associated with cataplexy, which is a complete loss of muscle tone during waking hours. In other words, people won't be able, they'll just fall down, they just lose all muscle tone, and can't control their muscles during a narcoleptic episode. So narcolepsy can be caused by genetic factors, or specific types of brain damage, or also a lack of orexin. So orexin is a neuropeptide that regulates arousal, wakefulness, and appetite. So if you have a lack of orexin, then you're not going to be able to feel wakefulness. So obviously you're going to more easily fall to sleep. Also brain damage to some areas can also cause this. And then if someone closely related to you has narcolepsy, you are at an increased risk of also having narcolepsy due to this genetic factor. The next sleep disorder is sleep apnea. And sleep apnea is a blockage of the airway that interrupts sleep. So pretty much this person will be sleeping and then will all of a sudden stop breathing. And this is due to a blockage of the airway. So this blockage usually will wake a person from deeper levels of sleep. So from levels 3 and 4 or even 5. However, it can be dangerous because not everyone will actually wake up during the sleep apnea episode. So this is where, treatments come into play, because if you don't treat it, then people can actually die from sleep apnea because of not being able to breathe in their sleep. And now this, normally a blockage of their airway happens and then clears up pretty quickly in their sleep, and it will actually occur about 100 or 1,000 times every night. You'll get a blockage. And again, what this can cause is really a lack of deep sleep. And so a person with sleep apnea may experience symptoms similar to insomnia. Next one we're going to talk about are night terrors. So night terrors are different than nightmares. Let's just get that clear. Night terrors are way more intense than a nightmare, okay? Night terrors, then you'll see a sudden waking episodes characterized by screaming, perspiring, and confusion, and then followed by a return to a deep sleep. So what you'll see is people will wake up screaming bloody murder, completely terrified. They'll have no memory of what caused this, and this all usually occurs in stages 3 and 4 of deep sleep. This can last a few minutes, and then the person will actually usually fall right back asleep, and they'll go straight back into stages 3 and 4 that they woke up from. And so someone with night terrors, then they usually are experiencing this a few times, like a few nights in a row, or maybe once a week or something like that. It's usually more than a one-time thing. And we do see this in patients with PTSD, as well as other people can just kind of develop it. Now the last one we're going to talk about is sleepwalking. So sleepwalking takes place in stages 3 and 4. And this is episodes where a person who's in this deep sleep actually gets up and walks around. And we actually see this in 15 to 30% of children. And then as people age, they actually become less likely to experience sleepwalking. And so only 4 to 5% of adults will sleepwalk occasionally. Now, people that sleepwalk, it's usually not an every night thing. It's usually just an occasional thing. And it's usually because people that are deprived of sleep are more likely to exhibit sleepwalking when they do fall asleep. And part of this is because, remember, we talked about during stages 3 and 4, as well as during REM sleep, your body paralyzes your muscles to prevent, pretty much to prevent sleepwalking and to prevent you from hurting yourself during your dreams. However, we see sleepwalking in people that are deprived of sleep, mostly because your body's just not used to the having to paralyze itself. They've kind of forgotten to do that while being deprived of sleep. Now, I do want to state that there's a myth that you don't want to wake a sleepwalking person, that it's dangerous. That is false. Go ahead and wake up a sleepwalking person. You're not going to hurt them. They're not going to hurt you. Just wake them up. It's best for everyone. So that's it for dreaming and sleep disorders, and I'll see you in the next video.